Welcome to the Positive Gene Podcast. My name is Sara Kavanaugh. This is a podcast empowering cancer previvors and survivors over our hereditary cancer risk. We're all in this together, and I'm so thankful for your support. Let's dive in. Welcome to the Positive Gene Podcast. This is your host, Sara Kavanaugh. As advocates, we spend a lot of time talking about the changes we'd like to see in healthcare, whether it's improving access to genetic testing, expanding cancer screening, or just simply removing barriers to care. But what many of us may not understand is how those changes happen or how our voices can actually influence the legislative process. I know I didn't. A few months ago, I was at the Tennessee Capitol for Susan G. Komen Advocacy Day, meeting with legislators to discuss important issues to our community. Now, these meetings can feel a little intimidating, especially the first few times you walk into a legislator's office wondering if your story will make a difference. And that's where I met today's guest, Representative Bob Freeman. Our conversation clearly left a lasting impression on me because, well, he's here today with me. Our conversation helped demystify the legislative process and reinforce something that every advocate needs to hear. Your story matters. Legislators rely on advocates, patients, caregivers, and healthcare professionals to help them understand how policies affect real people. Meaningful change rarely happens overnight. It happens through relationships, education, persistence, and showing up. And that's exactly why I wanted to bring this conversation to all of you. Representative Bob Freeman represents Tennessee's 56th House District and serves on the House Health Committee and the House Ethics Committee and others, and where he helps shape healthcare policy while promoting accountability and public trust in state government. So outside of the legislature, Bob serves as the president of Freeman Webb, a Nashville-based real estate investment and management company. Now, what I've learned is that Bob is a strong believer in public service and the important role that advocacy plays in shaping thoughtful policy. He and his wife, Rachel, CEO of the Sexual Assault Center of Middle Tennessee, share a deep commitment to serving their community and improving the lives of Tennesseans. It's really an honor to have met you, and I appreciate you joining me on the show today.
Well, thank you for having me. This is great, and you hit the nail on the head. If you're not at the legislature and talking to your legislators, advocating for the policies and actions and policies that we want to see the Tennessee State Legislature do, somebody else is going to fill that void, and they are not going to have our best interests at mind. And so hearing from individuals and Tennesseans about what they want government to do for them and what protections they need is so important. And one of the things that I always pride myself on is, you know, I'm an open book. I want to listen to what people say. I want you to educate me. I gather the information and try to make the best decisions I can. And sometimes it's hard. There is a flood of special interest groups and paid lobbyists that are constantly in the ear of the legislators, trying to tell them sometimes what isn't real. And again, people like you and the Susan G. Komen Society and organization coming down and sharing their stories is so important because it matters. If we didn't invest in this and believe in the science, my wife wouldn't be here. And I'm not unique, right? That is a case across our state. Over and over again, you know, people are diagnosed with cancer. It's a scary, frightening diagnosis. You don't know what's going to happen. And having real science that's backed in science that people understand is important. And sadly, that's under attack today. So again, thank you for doing this and inviting me on.
Yeah, absolutely. I appreciate it. So before we dive into the legislative process itself, I want to start with why I wanted to have this conversation, because this has been a learning experience for me as well. Over the last few years, I've had the opportunity to participate in several advocacy events. The first one, Forces Virtual Advocacy Day. And then I've spoke before the Tennessee General Assembly, the Susan G. Komen Advocacy Day, where you and I met, and then meeting members of Congress during the Rally for Medical Research in D.C. last fall. And even after those experiences, I can still remember how, you know, you're sitting across from elected officials like yourself, often alongside physicians, maybe a genetic counselor or researcher or other expert, and wondering how you can possibly add to the conversation. But over time, it has become clear to me that while those medical experts are incredibly important because, like you said, they bring the science, the evidence, the clinical perspective, but what they can't provide is the lived experience. And in our case, navigating genetic risk, what screening is like, the treatment decisions, insurance barriers, and the role of caregivers. And that's where the advocates and patients really become essential in that conversation. And you really reinforce that perspective. You help us better understand that legislators don't just want the data. They really want to understand how their policies affect real people.
The Tennessee State Legislature and the U.S. Congress, we have a representative government. And so the people that we elect to send to represent us in Congress, in the State House, and the State Senate, and U.S. Senate, are members of the community that they represent, right? And so they're usually not doctors. I think maybe there are 5 doctors, maybe 4 doctors that I serve with in the legislature. I don't have a medical background. And so you either have to give up your trust and just believe that the doctors are being honest with you, which I traditionally do. And then you have to listen to how your policies affect people in the day to day outside of the medical decisions. And, you know, the idea that you as a patient has to go to, 10 different doctors to try, different steps and stages along your cancer treatment journey, when there's a doctor going, hey, there's a better way to do this. And because of insurance decisions that is by and large, actually exclusively a legislative decision, you're not allowed to take the steps that the doctor at the other end knows is now the best course of treatment. And so it's very important for the legislators who've not had a cancer scare in their family or around their hemisphere to understand how the decisions affect people's mental health and well-being and likelihood to survive a cancer diagnosis, and whether or not it's going to bankrupt them. In Tennessee, we have one of the highest occurrences of medical bankruptcies. And so when you are someone that's sitting there trying to decide your cancer treatment path, and part of the calculus is whether or not you can afford it because your insurance isn't going to cover the appropriate treatment, those aren't decisions that Tennesseans should have to make. I tell the story all the time. When my wife and I were sitting in the lobby waiting for her to get her labs tested to decide whether or not she was healthy enough to do her chemo treatment for that day, we were 15, 20 feet away from the financial aid door. And knowing the stress and fear and uncertainty that we were going through as to whether or not the chemo is going to work, is she going to live? We had many nights sitting up talking about her funeral would look like, how I was going to raise our kids if she didn't survive this. And knowing those families had those same decisions. And then on top of it, knowing they didn't have the money to pay for the treatment, and then knowing that, we're just going to do it and hope that down the road it gets paid for, or we figure this out. I just can't imagine the weight that would put on. It makes me emotional.
Yeah.
The weight that it would put on somebody, because I know the weight that it put on me. And I know that we had the money to pay for it because we had insurance. And again, those are decisions that legislators make because an insurance company will come in and can tell them that service and or treatment is excluded from your insurance, and or that process or stage or steps in a treatment protocol is excluded because of insurance. And having you come down and share your story is so powerful because it's the only thing that can counteract the power of the lobbyists. And so I just wanted to make sure and note that, because it's extremely important to hear the voice of advocates and not just doctors and lobbyists.
Yeah, absolutely. And I appreciate you sharing your personal experience with this, because I think hearing patient stories may, bring that back to light for you, right? Giving you a whole different perspective when you're seeing advocates come in with their cancer story, and when you are making decisions that are for the greater good of your community and of your state. It's unfortunate, though, that it had to come from your own lived experience as a caregiver. So what would you say to someone who's maybe hesitant to meet with the legislators because they don't think their voice or their story is important enough?
I would say that everybody's voice is important. And the thing that I always encourage is, if you ask the average person, you talk to the person in line to you at the grocery store and ask, who is the president of the United States? 99% of people are going to know who that is. If you ask them who their governor is, they're going to know. If you ask them who their U.S. senator is, they may know that answer, may or may not know Congress. Almost guaranteed will have no idea who their member in the state legislature is and or in the state Senate. And those positions, the state house and state Senate, are so important. We exclusively set the policies that affect Tennesseans. We set the state budget. We set the funding mechanism for our public education, the funding mechanism for our state roads. And so having that relationship is an easier barrier. I mean, live in the neighborhood that I represent. I go to the grocery store. I go to church. I mean, my kids won't go to the grocery store with me anymore because I get stopped the whole time and people talk to me. So building that personal relationship with your individual legislator and state senator is extremely important. And secondly, being a trusted voice, an advocate for the cause you care about is unparalleled in its influence. You can send emails, you can call, but sitting down face to face and letting these people know that the decision that you make could cost me my life, could cost me my loved one's life, could bankrupt me, could force me to move out of the state because you don't support people like me is extremely powerful, because otherwise you're a number on a piece of paper. I tell people all the time, it's easy to hate an idea of something. It's extremely difficult to hate a person. And so putting a face to the cause, putting a name to the cause, talking about your family member, your loved one, or yourself that had a cancer scare, and saying it by name puts a little bit more weight on that decision and makes it much more difficult for them to make a decision based on, the bottom line of an insurance company, or the future success of a drug company, or whether or not you buy those drugs at a specialty pharmacy or through a PBM, or through your local pharmacy. All of those become almost irrelevant, right, to protecting your loved one and making sure that they get the treatment that they care for.
Yeah. So I think while we're on this thread of how people can get time with their legislators, I've been fortunate to have gone through the nonprofit organizations that already have established relationships with the offices, right? What does this look like for an individual? Like, how are people reaching out to you, and what does that process look like? And are you the exception or the rule? Like, what does it look like in general terms?
I think it's across the board. But I'm doing this because I want to make Tennessee better, and quite selfishly, I want to make it a place that my growing kids want to move back to when they graduate from college. And I know that I speak for a lot of Tennesseans. That's what they want. They want their community to be thriving in a way that their children are going to move back and they can be around them. And if you don't have kids, you want a place where you can live a great life and afford your housing and have a great job. But I think that you hit the nail on the head. One of the easiest ways to do it is find an organization that is advocating for the cause that you care about and engage with them. And that multiplying effect of them both sharing information and data, bill numbers, they do bill tracking, is invaluable. And the alternative is you doing it yourself. And if I'm being totally honest, I think it's been designed to be purposefully confusing. Committee meetings are, posted, not immediately before, but not quite, I mean, you don't get a notice like a month before when a bill is going to be heard. You may get 24 hours. We have an interesting policy where someone can have a caption bill and they can put an amendment on it. So you don't even know what a bill really does until it's presented in the committee. And then it's already on its path to becoming a law. And so a trade organization is going to, track captions, track pieces of the code that can affect an issue that you care about, and have a little bit more, foresight and go, this could be a problem. We should probably pay attention to this, or we should reach out to the sponsor and ask what their intent is. That I don't think the average citizen either has the time or knowledge of even how to ask those questions. And so my advice is always engage with the organization that is working on the issue that you care about and really engage, really be a soldier. And when they make the call and say, hey, we need bodies because, Bill XYZ is getting ready to be heard, and we need you to come down to share your story and talk to legislators. Do it.
Mhm.
Take time and go down and make sure that your position and usually it's the position of most of Tennessee is heard because otherwise somebody else is going to be advocating for the other side and they don't really care. They're being paid to fight against a good idea because it's going to cost somebody.
And I think it's important sometimes when we walk into those rooms, whether we're aligned politically or not, we have to remember that oftentimes a lot of the same things that we're walking into the room with, right?
I always tell people that the idea that there's this constant battle royale between Democrats and Republicans, it's just not true. I mean, there's so much in the middle that we agree on, and the middle is where the work gets done.
Hmm.
The idea that a cancer treatment or cancer therapy or how it gets paid for is a Democrat or Republican issue is pretty comical. Cancer doesn't care, right? Cancer doesn't care if you're Republican or Democrat. They don't care if you vote, don't vote. um, you know, if it gets its hooks in you, there's no politics that's going to change that. And so the idea that we should legislate it in a partisan manner is laughable. And so having the idea that we can have these conversations without putting on our red and blue jerseys is how everybody should go into it. I mean, vote for who you want to, and you should absolutely vote your conscience, but you should expect your elected officials to hear, regardless of your party, how best to treat cancer patients.
Hmm. Oh yeah, absolutely. So let's switch gears a little bit. We'll do a little bit of the Schoolhouse Rock, how a bill becomes a law. We'll talk
I'm not going to
through.
sing, no. I won't sing.
But really understanding the legislative process. I mean, you've given us a little bit of insight, right? But when many
Sure.
people only hear about legislation once it's in the news, or maybe after the vote
Yeah.
has already happened, I think that that's probably par for the course. But what happens when, from the time an idea becomes a bill, and then because I can speak for the one that we were working on, it was back and forth when we met with you, and then it came back on, and then it was taken off because of the fiscal note, and then it was put back on, and now it's moving forward. And like you said, it can be fairly unpredictable, but maybe you can speak to, rather than getting into the technical details of how that happens, but what does the public usually misunderstand about that process?
Yeah. Yeah. I'll just tell you how it works. I mean, and so I know when I got elected, I was actually, when I was running for office, that was one of the things I was the most nervous about. I didn't know what I didn't know, but I knew there was a lot that I didn't know. And
Hmm.
so, how this process works. And we have a team of professional lawyers that work with all the legislatures to draft legislation. And so for me, I will sit down and have someone like you come talk to me and say, this is the gap that we need filled, or this is the issue that we need solved, or this is something that we need to streamline and make easier. And I can literally take that idea, draft it on a napkin if I wanted to, and submit it to our legal department, and they will draft it into fileable bill form that addresses the correct portions of the code and is constitutionally accurate,
Hmm.
and or is constitutional is probably a better way to put it. And that bill will then come back to me for review, and I get to adjust it, share it with whoever I want to. This can come from trade organization, it can come from an advocacy group, it can come from a lobbyist, it can come from a business, and it does. It comes from all those different, or it come from an individual.
Hmm.
And and then I decide when I want to begin moving that bill through the legislative process. Traditionally, this is when if I'm working with a group, like if you had come to me as a cancer advocacy group, I would engage with you and have you go out and talk to the 6, 7 members of the subcommittee and share your story before I put that bill on notice. So when they hear my bill presented in committee, they have heard individuals talk about why this change is needed and how it will impact them. We have a committee process in Tennessee So it gets announced on the House floor. It gets assigned to a committee. As it works its way through the committee, if there's a fiscal note on it, meaning if it costs a penny or makes us money, it has to go to Finance, Ways and Means to get approved. And so it has to pass the committee process first. So, for example, some of these bills that you're talking about went through the insurance committee. So insurance sub, insurance full, it has a fiscal note. It goes to finance as an approved bill voted on by the insurance committee. And then the finance committee has to come up with the money to pay for it. So that means we have to go to the governor's office and have it included in the budget. We have to find money from another agency. We have to figure out, does it save us money and we can move stuff around? That's when a lot of the nuance gets into it, because it's a more tricky process. And then if it passes that, it goes to the floor where it's presented for a third, fourth time in front of the entirety of the body. So now you've got all 99 members, of which, maybe 20 of them have ever heard this before. And you have to stand up and present the bill a final time. And if it gets a majority vote, it goes to the governor for signature. The caveat there is that same process is worked its way through the Senate. And so as you're presenting a bill, in order to get an organization or a member on board, you can do an amendment to carve out a group, to change the language, to change the name. And if that version is not the same as the Senate version, they come back before the two bodies as non-conforming versions of the bill. And either house is then left up with a choice. Do we accept the other version, or do we want to stick with ours? 95% of the time, maybe even 98% of the time, one body agrees with the other body's version, and we just go back and substitute conform with the other version. If we don't, it'll go to a conference committee, and we will debate and argue in a small group which version, or we can change the bill completely again. And then it would come back before both bodies for a final vote. But at the point that most people find out about it is usually after it's been either put on notice in the first subcommittee or it's been voted on and discussed in the first subcommittee, because, as I talked about earlier, it has an amendment on it. And so nobody even knows what the bill is doing until you present it in the subcommittee. And then it'll go with a traveling amendment into full, and then it gets put on as the committee amendment on the House floor. So clear as mud, right?
I've seen disparate parts of this take place,
Yeah.
right? And I appreciate you kind of creating that thread. But what baffles me is how long that process can take and what happens when it fails, right? And you have to loop back. So,
yeah, I mean, so how long that process takes or how quickly it can take. I mean, I'm always amazed. We can suspend the rules because the rules aren't in the Constitution. The Constitution says that the House has the ability to set our own rules. And so this slowdown process is in the rulemaking process that we can change. We actually vote on at the beginning of every year whether or not this is how we want to conduct business. To me, it's a great way because it allows, you get to present it subcommittee. People that maybe weren't paying attention are now paying attention. So now they get to go to the full committee, have their voices heard. If it doesn't work there, it can go, the House floor. So you at least have 2-3 weeks. When we get towards the end of session, we have probably some of our most meaningful bills that get introduced on the House floor, immediately referred to a committee. That committee meets that afternoon. It goes from that committee to the full committee. And then the next morning we vote on the House floor. And so now you've got wide, reaching, changing laws that we pass in 24 hours, making it almost impossible for advocacy groups to even keep up because, it's not on the dashboard until that night. And then you've got to figure out where to look, B, now you've got to go back and cross-reference the changes because sometimes it can just be deleting section 2 of Code 104-295. You got to know what that is. And that's why I say it's really important to work with advocacy groups because they're subject matter experts that know what parts of the code affect their organizations and causes and can have a better understanding.
You've really given us some insights into the process and what you can do to, I think, better understand that it can be low barrier, having a relationship with your legislator. All of those things are really important. I think you've given us some insight into what that looks like.
Yeah. And I want to make sure, no, it is low barrier, but they may not agree with you. Right.
Mm-hmm.
I mean, they're just because they represent you doesn't mean that they're going to vote how you want them to.
Good point. Mm-hmm.
And I always encourage people to be respectful. I mean, obviously differing levels of decisions deserve differing levels of respect. And just because you've elected me doesn't mean I do what you say. I listen to the majority of my constituents, and that's an important distinction. But now, if the majority of your constituents want you to do something and you are listening to a lobbyist instead, it's probably time to start looking for a replacement for that person.
Mm-hmm. And that's just it. You spoke to this a little bit earlier. As advocates, we're individuals in the community. We don't have that financial backing and resources to be able to come, and bring armies of people, right? And so that's
Right.
why when there is a call out for advocates to show up, be there, speak to, if you can speak to it, or just be a supporter in the room, right? I think
That's right.
that can really be very meaningful.
And I will say that, and this may be changing course a bit, that's quite frankly, that's the easy work, right? To come down and sit in the chambers in, February, March, April in the air conditioning, when you have time off, is the easy part. What we need to do is remember those that are not voting in the best interest of the rest of Tennessee, and mobilize and go knock on doors in the heat of the summer in August. I mean, it'll be 100 degrees today, and we have, state house races across our state. And we have the ability right now to select who we want making decisions for us in the legislature. And those that are not listening to us, they need to be replaced. And they need to know that if they're not going to, listen to the constituents and do the bidding of special interest groups and lobbyists and insurance companies and yada, 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 that there's a price to pay for that. And you're not going to be there come January.
Yeah. I'm walking into that going, why wouldn't they want to fund this? And they may say, yep, I agree with you, but there is some kind of, counter to that. And what could
Sure.
that be? Like what things are they potentially facing?
It's almost exclusively dollars, right? It's money. They've got a wealthy donor that has funded their campaign that thinks that, if we pass this bill, it'll affect their bottom line. Is it good for the constituents? Yes, but it will, affect their bottom line. I use a great example. And we've had a bunch of bills dealing with genetic testing. You brought it up a couple of times. And, there was a very real fear initially. And I argued over and over and over again and ensured actually it was specifically excluded, that you would go in or someone would go in and have their cancer genetically tested so that we could find out exactly what the treatment protocol should be. And, that programmatic XYZ, your 1, 2, 3, 4, 5, whatever you want to say as a treatment protocol,
Mm-hmm.
that we got to benefit. My wife had the benefit of doing. We knew what it was, and it was a very prescriptive treatment protocol that was different than, the other 10 people that were sitting around her when she was getting her treatment. The fear is that they would submit that to insurance companies and allow an insurance company to exclude your coverage because, my wife had a BRCA gene or you had the BRCA, whatever it is, and now be able to exclude you from them having to cover cancer treatment. And the reason for that, it was shared that because there are several of my colleagues on the other side of the aisle that voted to allow for that exclusion. And the reason was given is if we don't exclude it, it's going to run the cost of insurance up, and or we're going to become insolvent, and or we're not going to be around because we're going to be so broke. It's a lot of fear tactics like that
Mm-hmm.
that I don't think are valid. That, and I'm just going to sound like a broken record, that an individual coming in and sharing their story that, hi, my name is Sarah, and I'm advocating for this, or hi, my name is Bob. My wife would have died without these treatments. My 3 young kids would have grown up without a mother. That's a tough one to go, oh, well, but insurance companies need to make money. And so having that push pull that rubber band, stretching of the legislative process. We can't allow it to just be that one side saying, well, no, we're gonna not be able to have insurance anymore if we do this. Nonsense.
Right.
It's all these scare tactics, and if they don't have the knowledge and or really the courage to push back, that's the fight.
Yeah. No, that's helpful to understand. Let's talk about the meetings themselves. You've already talked about how meaningful conversations are
Yeah.
for the advocates and patients, but what makes it particularly memorable? What can people do to help amplify whatever message it is that they're trying to send?
Yeah, I don't know that I've got a great answer for that. I think that just being honest, the one that is always the big red flag for me is when someone comes in and says something that I know to not be true, or they're trying to direct a conversation down a path that is just not intellectually honest. And then I tend to kind of shut down. And if you're gonna lie to me once, I'm gonna assume everything you say after that is also not true. So I kind of shut down. And so just being honest, and we've said it a couple of times, we're not always gonna agree, and that's okay, but not dancing around it, milly mouthing your answer because you don't think they're gonna agree. Be true to who you are, and make a statement. That doesn't mean that the other person or you are right or wrong or better or worse. You just have a disagreement. Sometimes the disagreement in policy, you have the goal, and how you get there is different. And so, you think we should go this way, I think we should go that way, and whatever. But as long as you establish that we all have the same goal, you can totally disagree,
Hmm.
and be respectful. And I've said it before, different decisions deserve different levels of respect, but be respectful, and know that, as long as you agreed on the end goal, the path to get there doesn't really matter. But I respect when people just own it. Listen, we disagree. And instead of like, well, sometimes on Tuesdays, I don't know that I feel that way today, but just say what it is, and let's move on. Because if you don't have a statement of facts and kind of a foundation of where you're all arguing from, you can never really, or debating from, you can never really get to a solution.
Yeah, for sure. We've often walk in with our talking points, right, where we have the data to support it, but really what nets out is that personal story and how this law could impact you as an individual. I mean, really, when it comes down to
Totally agree.
brass
Yeah.
tacks, it's like, how does this affect
Yeah.
me and my family
Right.
and or my community, right? And so,
Yeah.
as a hereditary cancer advocate, there's a lot legislation that has influenced our community as of late. A lot of it has been moving forward though. And it's because
Sure.
of these voices that have come to folks like yourself who have really understood. We're learning more about genetics. We're really learning how the hereditary impact can inform prevention. It can inform treatment. There's so much that can come out of that. But you can't walk into these meetings assuming that they understand or even have had a firsthand experience with it.
And I will tell you this, sadly, science has been under attack in the United States, and definitely in Tennessee in the past several years. And so, kind of removing that and just making it personal is usually a safer bet, because many of my colleagues, when you start talking about science, they're just like, they automatically discount it because they don't understand it. And because they don't understand it, they think they're being misled. And it's just this weird circular reasoning of like, why they can justify not believing science. And I'm just like, okay, well, here is Sarah, and these policies saved her life. And that it's very black and white.
Yeah. Do you have an experience that you can share where a patient advocate genuinely changed your perspective on something, or maybe, changed how you approached a piece of legislation?
I mean, sure, all the time. I'm not a subject matter expert on everything, or really many things are in a legislature. So I have people that I trust that I listen to all the time. And sometimes I may have a preconceived notion of what policy position I want to take, and the direction I want it to go. And I will drastically, change my mind, from, a hard no to can I also sign on and be a co-sponsor of the bill? And I think that's healthy. I think people need to uh, be able to change their mind all the time. I mean, I had a teacher in high school that always said, I mean, I know you think you're right, But think about this for 1 second. Why would you knowingly hold a belief that you knew to be wrong? And I was like, okay, well, that makes sense. It's like, and sometimes you don't know that you're wrong. So of course you think you're right. So don't always be so dead set on digging your heels in and fighting. Actually open your ears and listen. And if you're sitting there while someone is explaining their position, only thinking through what your rebuttal is going to be, you're not really listening. You need to be truly open and receptive to admit that you were wrong, and or you didn't fully understand the facts as you believed them, and that
Mhm.
happens to me all the time.
Mm. I just so appreciate your humility in acknowledging that you're not perfect. You're going to change your mind. Experiences are going to come to you. People are going to bring you stories, and just to hear you say, "I acknowledge that I have my faults." I just appreciate that.
Well, and I appreciate you acknowledging that. I mean, I think that a lot of my legislators, it's kind of the joke. It's how they vote is based on the last person that talks to them, and as opposed to the first. And that's definitely not my voting strategy. But if someone comes to me first and they may not be fully forthcoming on the facts, that may frame how I view. And there's a debating sales, whatever, called anchoring technique, called anchoring, where you anchor someone's belief in way over here. And so to get them to the furthest extent seems too far, when actually the middle was 100 yards further to the left. And then so it's really not that far of a stretch to get to that next belief. And so a lot of the lobbyists will come in and use that technique. They'll go so far to the extreme. To get out of that extreme takes so much intellectual effort. So they just, they never change their mind. I always joke it takes some intellectual curiosity to do what we do. You
Mhm.
have to want to learn and understand issues below a surface level. And we just don't have the time. So you have to trust people that you believe are giving you the best advice they've got.
Yeah, for sure. Before we wrap up, I want to speak to you a bit on the genetic screening and access to care, on a couple of things that we have advocated for recently in Tennessee and even some at a federal level. But if can speak to the Tennessee piece, what we do here may be informing what's happening in other states, right? And they may use us as precedents. And I think that's really meaningful for us advocates who are sharing our information across the country. And I guess I don't really know what my question is here, other than to say, like, what are things that you can speak to that are happening now within the state, and how similar priorities what we can do to make sure that they continue to gain traction? I guess maybe that's the question I'm asking.
Yeah, I mean, again, I think that starting at the beginning, making sure that we're supporting good legislators that are, truly trying to advance sound policy for all of Tennessee, is where it begins. And then once that happens, making sure that you're staying in front of them, that they have the best information possible, that they are, as educated as they can be, and know, both the risks and rewards of possible legislation as it's being discussed. So I think that's extremely important.
And that's the thing about having that camaraderie within the advocacy organization that you're in, because there are things happening in other states where we can say, boy, maybe we need to revisit this in our own state. That's a great way to build that grassroots effort and get the lessons learned, and in my experience, that has happened where
Sure.
boy, this approach didn't quite work in this state. We're going to take this approach. And so that's, again, where those advocacy organizations can really help you go in armed with that information more effectively.
Yeah. And usually the more people look at these things, the better ideas you have, and the more inclusive the language and or the legislation can be. Because as hard as I try to see all sides, I'm still human, and I see things through the lens of my life and how it affects me. And it may be totally different from you. It may be totally different from my neighbor or someone that lives in Brownsville, Tennessee. And so having more eyes on it ensures that you're thinking of all angles, right? You're thinking of
Mhm.
all people across the state. And while again, I do my best to try that, I'm not perfect. I am human, and I don't see everything. So that same can be said for bills that go statewide. Something that affects us here in Tennessee, maybe not as important for someone in Delaware. And so, having all these different trade groups, all these eyes looking at it, I think makes for a better and more inclusive legislative process.
Yeah, absolutely. Where do you think advocates can make the biggest difference? Like if we're kind of sticking into the healthcare side of things, what do you think are our biggest priorities right now?
I think for sure cancer research and ensuring that we have the ability to do, all the research in Tennessee that we want. And right now that's not the case. And so I think that's problem number one, because if we're not doing the research, we're going to continue treating the way we've been treating, which means we're going to continue with the same mortality rates. Uh,
Mm.
the mRNA that we saw come out in the COVID vaccine. When that happened, I remember doctors explaining it to the entirety of the legislature, what it was, how it was meant to be. And the idea was at some point, we're going to be able to drag through genetic testing cells from your cancer, put it into this mRNA vaccine, put it back into your body, and your body will fight the cancer for us. We're not going to have to do chemo. We're not going to do radiation. Your body itself will fight this cancer. And we're now seeing it, right? And if we have a meaningful percentage of the legislature not believing science and not believing in the mRNA vaccine and the way it was designed, we're not going to be able to advance cancer research. And so making sure that we educate these folks in a nonpartisan way of what exactly it is that we're doing. I've got a friend right now whose daughter is dealing with brain cancer, and they're doing an mRNA vaccine, and they're raising money to pay for it because it's $600,000, and to be put in a position where you have to make a financial decision as to whether or not you have the ability to try this path of treatment is not fair. So we should be talking to insurance companies, and, we should be forcing them to, you know, let's do what we can. That we should be able to, do all the research, and let's do a moonshot type national push to try and cure cancer. We need to have national, statewide, through health departments, research programs. We used to have a lot of them, and they've dried up. We have a lot of medical funding at schools right here in our backyard at Vanderbilt that have dried up, and they're no longer getting these federal grants that they once got. And so now they're being forced to go back and fundraise through private individuals to do it. We should go back to having publicly funded research projects that are wide reaching and cutting edge. And we're just not doing it. That's on a federal level. On a state level, ensuring that, we have incentives for doctors to move to Tennessee and, take chances and do real trials and try to find creative ways to solve this.
You're right. It's been disheartening to see the resources being dried up and moving elsewhere, unfortunately, when there's so much potential and such a big need. This has been so incredibly helpful. It's hearing directly from the person that is going to help move these things forward, right? We can do what we can as advocates to really help inform you, but really relying on you and getting to establish a relationship with the legislators is key. And I do want to bring up one question for you related to that. You coming from a cancer caretaker background, you have supported the legislation that our advocacy team has come to you with. So there's lots of reasons for you to do this. If people want to reach out to legislators that are maybe sponsoring or co-sponsoring bills in their state, but they're not a constituent, inform me in that it's acceptable to do.
100%. You're going to get differing levels of response. But, I always view I get elected by the people of the 56th House District, but my decisions affect all of Tennessee. So I'm going to listen to people that want to have their voice heard about policies that we're working on for the entirety of the state. My decisions don't stop and start in the 56th House District. And so that's how I look at it. Not all of my colleagues have the same mindset, but still reach out. And so having that email, that's why I said that one email matters. Sending that one email, making that one phone call. It's the weight of the entirety of it that matters. Your individual phone call may not sway a decision, but your phone call, your neighbor's phone call, and the 200 after, they all matter. So, reach out to whoever. If they're not listening to you, they're not doing their job. This isn't my seat. This is the people's seat. And I'm not in charge of any of this. I am here to represent the people of the 56th House District who've sent me up here to do that, and the people of Tennessee. And if they don't want to do it, remind them. And if they still don't do it, work to get them replaced.
That's right. Get out and vote.
That's it. Yeah, that's a big one. Everybody needs to vote. We have the lowest voter turnout of any state in the union. So we're allowing a minority of voices to decide elections.
Yeah. Though I know you shared some of the challenges that we face as a state when it comes to cancer research specifically, and what some of our research organizations and universities are facing. But there's got to be something that still gives you hope about the future of healthcare policy in Tennessee. What can you share from that?
And what gives me hope is what I'm seeing is a younger and younger demographic paying attention. They are opening their eyes and realizing that they're going to, graduate from college and not have access to healthcare. They're going to graduate from college and, be limited to the treatment protocols that they have because of, corporate interests and or financial decisions. And they're not okay with it. And so the future, I believe, is bright. We have an engaged, intelligent group of people coming up behind us. And I think that people, at current voting age and, people in their 40s, 50s that, thought the system worked, and they're now realizing that it's not. And so they're demanding change. The thing I always tell my constituents and people that I talk to is incremental change is change. And every year we're making, specifically with the cancer research, incrementally a little bit better, right? We're changing it, nipping around the corners. And to me, that's actually probably the best way to even change policy. If you just go in and throw it all out and start anew, you don't know if your change really had an effect or if what wasn't working before, if the outside influences. And so small incremental change to me is the best way to do it. And we're doing that in Tennessee. There's obviously a lot more we can do, but we are making a change.
Yeah, for sure. It's the long game, right? We have to bear that in mind.
That's exactly right.
I just want to thank you for your time today and really pulling back the curtain on this process. It can feel overwhelming and inaccessible for many of us, but you've given us so much insight into how this process works and to put our minds at ease that this is doable and it truly does have an impact.
Thank you. Thank you for doing this and shining a light on this important work.
Well, in closing, I hope today's conversation encourages more people to step forward, to share their experiences and recognize that your voices truly matter. You don't have to be a physician, a researcher, a policy expert to make a difference. So for everyone listening today, if today's conversation inspired you, I encourage you to find ways to get involved, whether it's sharing your story, meeting with an elected official, or joining an advocacy organization, or simply learning more about an issue that matters to you. Your voice has the power to create change. Now, until next time, remember that knowledge is power, and your story may be exactly what someone else, or even a policymaker, needs to hear. We'll see you next time. Thank you for spending time with me on the Positive Gene podcast. Your support means everything. If you found value in today's episode, I would be so grateful if you could take a moment to rate and review the podcast. It truly makes a difference. For an in-depth look and links to resources discussed today, check out the accompanying blog on my website at sarakavanaugh.com.